Hello everyone. Today we will see the working of calcium arsenazo reagent. The kit is from Biolab Diagnostics. The kit contains one bottle of calcium arsenazo reagent, one bottle of calcium standard of 10 mg concentration, and instructions for use. We recommend all users to read it carefully. Apart from this, you will require additional items like pipettes, yellow and blue tips, stopwatch or timer. Before performing the test, let us look at the preparation of working solution. Calcium arsenazo is a ready-to-use single reagent. Hence, there is no requirement of preparing the working solution prior to performing the test. The reagent volume as per our procedure is 1000 microliters and sample volume is 10 microliters. Now, as per procedure, we need to take 3 tubes, one for blank, one for standard, and one for test. In the first tube, take 1000 microliters of reagent only, but you can add 10 microliters of distilled water. That is not compulsory. In the second tube, take 1000 microliters of reagent and 10 microliters of standard. In the third tube, take 1000 microliters of reagent and 10 microliters of patient sample. Mix it well and keep it for 1 minute. Now, as mentioned earlier, we have taken 3 tubes, one for blank, one for standard, and one for test. This is a 1000 microliter pipette, and this is calcium arsenazo reagent. We have taken 1000 microliters or 1 ml in all the 3 tubes. Now we will take 10 microliter pipette and add 10 microliter of standard in the second tube marked as S. Mix it thoroughly. Make sure to change the tips so that there is no interference and contamination. Now take 10 microliters of patient sample and put it in the third tube marked as T. Keep this mixture for 1 minute. Make sure there are no air bubbles. Program calcium on the semi-automatic biochemistry analyzer. Aspirate water. Now the machine will ask to aspirate reagent blank. Aspirate reagent blank. After a small lag time, the instrument will calculate the absorbance of the blank. Save the values and aspirate standard. Make sure to remove the tubes after aspiration. The instrument has calculated the absorbance and factor. Now again run the standard to calculate the standard concentration, which should be around 10 mg as per the specification. After a small lag time, we will get the standard concentration. The value is 10.19, which is as expected. Now run the patient sample from the third test tube marked as T. Now we will get the patient result. The patient value is 9.91. For expected patient values, refer to the literature. Thank you.